Welcome to Blue Oak NX, Mitochondrial Health and Health Span, an event held at the UCLA Mathias Botanical Gardens in Los Angeles. Welcome to Crystal O'Loughlin, founder and CEO of Raregivers Global.
So much excitement, and here's the good news for all of you. First of all, can everybody just stand up and let's do a little bit of a stretch and stretch your legs, move your body around just for a minute, because truly, here's what my commitment to you is. And if I could have my slides, that would be great. Fantastic. Okay, super. Okay, you're welcome to stay standing, or if you'd like to have a seat, that's fine. I'm not going to lead you in a little yoga a scenario here. But here's what I am going to do. I'm going to set a timer. Okay, so my commitment to you is just stay pretty close to the 10 minutes that I was allotted, because it's been a long day. I just want to say on behalf of all of the Rare mothers, the Rare families, young adult and adult patients, their caregivers, and the healthcare providers that are supporting them. Thank you for the work that the scientific community is doing. My talk is not about the science, it's about the heart. It's about the emotional impact of the waiting and the living with the day-to-day realities, in many families, unimaginable realities of care that our very brave families are living with. So we are in this symbiotic relationship, much like mitochondria is in a if I learned anything, mitochondria is in a symbiotic relationship with the body. We are in a symbiotic relationship with each other. We're all stakeholders in this experience. So, okay. So, my name's Crystal Barrett O'Loughlin. I did do a TEDx in Luxembourg. It was on caring for the caregivers, so I invite you to listen to that. I'm coming at this conversation, this view of this experience very differently. I'm coming at this from a technology perspective, as well as a marketing and communications perspective, and then lived experience. So mashing that all together is what I find passion in, and that's connecting humans at a heart level. So there's 3 different talks that I do. One is inspirational, another one is explanatory, and a third is on data. Ironically, I didn't bring the data talk, so I brought the explanatory talk today. We're going to talk about what Raregivers is. And I'll sprinkle in some of the data along the way. But in truth, this is lived experience for the Barrett family. I'm the youngest of 5 children. You can see my young mother, Phyllis, there on the left. And she did not know that she was a carrier of Hunter syndrome, type 2, mucopolysaccharidosis, a lysosomal storage disorder. So it's an X-carry disease. I am also a carrier, as is my daughter. So we have 3 generations of carriers in our family. And you can see my oldest brother, Richard, the golden child, right? All those classic milestones, he was hitting everything just perfectly according to plan. And David, Jared, and Randy had harder times lifting their head, crawling, and eventually did gain the ability to walk and talk, but then lost that ability over time as they missed the enzyme they needed to break down certain types of glucose in their body. I'm the youngest there of the 5 of us, ready to go off and do something about that. So my brothers did pass away in the 1980s. They were seen here at UCLA. We were talking about Elizabeth Neufeld. We were talking about their team also at UCI. Elizabeth was my genetic counselor when I was looking to start a family. So I have a deep history and love for UCLA, and you can also see that I went to UCLA. So I graduated in 1993 and was a Pi Beta Phi at Hillgard Avenue right across the street there. And it was the Pi Phi sorority sisters that helped me do what so many families do in the rare disease space, which is start an effort to make money and fund research. So we were part of the National MPS Society. We did what 20-year-olds do best, and we threw parties every year, and we raised a whole lot of money. And we did fund a treatment for Hunter syndrome that is now FDA approved. Young men that would have passed away in their teens are going off to college now. So we're seeing that full cycle of philanthropy, which is really amazing. We weren't the only ones to fund it. Obviously, it was a group effort. But we do a lot of advocacy for newborn screening so that those young men can get on that treatment as quickly as possible. Here's what hit me, and Monica and I share this history of being breast cancer survivors. So I'm 9 years cancer-free. And while I was working at IBM and while I was working with media and entertainment accounts, I always had it in my heart that I wanted to do more in the rare disease space. And when I got breast cancer, I realized my relationship with time had shifted, that I may not get to retirement to do all that extra fundraising that I wanted to do later in life. And so I set that corporate career aside and really went full into how are we going to help the reality of these families, because 350 million families and 0 cures is a global mental health crisis. So all those families had to be in emotional distress. So while the science is advancing, and it's advancing exponentially now, while the science is advancing, we wanted to do what we could to bring emotional relief into the family unit. And in all honesty, these are best practices in military and veterans caregiving, in senior care, Alzheimer's, dementia care, in cancer care, really involving the patient, their primary care unit, their care partners, and the healthcare partner ecosystem. So how do you affect systemic change on a global basis for 350 million people? Some say 2.8 billion, because we know we have 3 primary caregivers and 5 healthcare professionals, right? So we've got a big chunk of the planet that's really emotionally impacted. How do you bring relief into a very, very complicated system of support? Good news, we know how to do that at big companies like IBM and through entertainment entities like the Walt Disney Company. And so really what we're doing is we're bringing best practices of emotional connectedness into this system of support, right? So we say this isn't just caregiving, it's radical caregiving, Jessica Pate's phrase, extreme caregiving, right? This is 24/7 medical management, financial hardship, people coming out of their careers, the isolation that comes into the care cycle, and really having to step away from their careers, many. So we're still seeing the downstream impacts of this experience within rare, chronic, and complex disease. So we very much view this as a societal challenge, and that our answer at Raregivers is to address the emotional toll. So our swim lane is emotions, feelings first, of complex care. So we say that when life gets medical, people get emotional. But we have this sort of bias towards the fix. And thank God you do. Please keep doing the work you're doing, because that, in our lifetime, we're going to see the treatments and the cures. We're already seeing the nutraceuticals and these interventions. We don't have to wait for FDA approval on everything, right? We can use our ancient wisdom. I remember my mother with her Vitamix in the kitchen, just juicing every day to bring relief to my brothers, right? She knew intuitively, right? So there's so much we can do with our ancient wisdom, but when life gets medical, people get emotional, and if we ignore the emotions, we're in trouble. We know that we're in trouble, and those caregivers in particular are in trouble. So this is what we developed. It's called the Raregivers Emotional Journey Map. On the table over there and outside are copies of this. You're welcome to take a copy home. And behind this pretty picture, and it's designed to look like a video game because we're making a video game out of it so that we can teach people in the way that they want to be taught, is 287 pieces of published research on the emotional impact on rare, chronic, and complex disease families. Okay, so we started with a meta-study, and then also 21 cohorts of individual groups that have gone through our training that helped us make the journey map representative of their experience. Let me tell you what wasn't in the data. The end of life and finding meaning stages. Okay, when a patient passes away, their relationship with the healthcare system ends. So there wasn't data about the downstream impact of the grief cycles on the family. Right? So it was the families that said, wait, you're missing this cycle. Okay, a couple things. Over on the left, when life gets medical, you get thrust onto this island, right? It's very isolating and you don't have a roadmap to your feelings. This is not a linear journey. You don't step 1, 2, 3, 4, 5, 6. This is more like chutes and ladders. You can be in a diagnostic phase, adjusting to a diagnosis with or without a diagnosis, because we know that on average it takes 7 to 8 years to get an accurate diagnosis, and families will be misdiagnosed 3 times. You can be in a diagnostic phase and end up in the ER and worried about end of life, right? And then go back into a bit of homeostasis, but still be grieving what you thought life was going to look like, or what you thought your role looked like as a mother or as a spouse, right? Or what you thought your child's life was going to progress like, right? So these are what we call cycles of hope and grief, and it's very much the yin with the yang, right? We have the capacity as humans. Our superpower is empathy and love, and we have the capacity to hold both at the same time, right? The joy and the pain, the dark and the light, the worry and the hope. So this journey map is really just designed to be a talking tool. We're not trying to fix anything. We're not trying to progress people from crisis to wellness. What we're trying to do is provide a system of support where people can talk about their feelings. And how do you get off the island? It's all the ancient arts, what we know we're supposed to do. More sleep, get out in nature, eat better. That's where the connection with Blue Oak Nutraceuticals comes into play, is nutrition, right? How do we use nutrition as a way to heal ourselves even as we're under chronic stress? Physical activity, connecting socially. There's a beautiful article in Psychology Today that actually talks about people would choose social connection over medicine. Right? You can be, but there's reasons why people come off treatment because of anxiety and depression and overwhelm, right? So we have to deal with the emotions if we're also going to be healing and supporting people. So I just want to mention that you can't just talk about feelings in English. So if you're going to talk about people's feelings, you've got to do it in their native languages. So we have a wonderful partnership. This is where our tech partners come in with Microsoft to translate. So once you can get things on a page and you get them into a short booklet, then you can translate. So we've translated into 12 languages. AI is enabling us to do 400 languages we're working on during our next hackathon. So why is that important? Because disease crosses borders, and it crosses language. So we need to be able to provide talk tools where people can talk to each other, even in other languages. And we prove this out by delivering this training in Hindi in New Delhi in November, right? That was our test case. We've also been training in Spanish, and we're about to kick off training in French soon. So I'm excited about that. So the Raregivers Global Network provides emotional support to caregivers, patients, and professionals in rare, chronic, and complex disease communities. We deliver daily compassion and relief, and we do it through tools that are mobile first, multilingual, and we do that through our partner network. So you saw all of those wonderful logos, and in particular, I just want to give a shout out to Blue Oak Nutraceuticals and also to We Are Brave Together, one of our newest partners in engaging within this community. It's our goal to emotionally support 3.5 million Raregivers by 2026. That's just 1% of the need. But it's a big enough number that we're hoping you will be the catalyst, right, to get people talking about their emotions. So we can bring these tools into the hospital environment and we can bring them into the homes. And I just want to talk about Jamie. Remember, we started this with hope and grief. We started it with the joy and the pain. And that is the human condition. Jamie lost 2 of her children at 18 months and at 8 years old to mitochondrial disease. Okay, she came to her first Raregivers retreat after her son passed. Then we threw a wellness get-together. It wasn't a full retreat, but it was more like a regrouping of that original group after her daughter passed. Then her husband went through our wellness training. And then Jamie went through the training again and then went home and found out she was pregnant, right? So these cycles are unbelievable. They're unimaginable what we go through. But we are all of this collectively together in this experience. And Jamie's one of our most amazing momvocates. She just was at Rare Disease Day with me at Boston Globe and sharing her story. And I just want to give a shout out to each of the families that are here sharing their stories, because that's what motivates the scientific community and all of our partners to keep doing the very good work that you're doing. Nutrition is number 3 on the 10 essential tips, okay? So remember your top 10 of what you need to be doing to bring relief into your life. And I know I went a little bit over, but I thank you for your time. And you can take these home, and we'll distribute them digitally as well. Thank you.
Thank you so much, Crystal. That was fabulous. And thank you all. You know, I have to say that an important part of what we're doing, an important part of what we're doing is really building community, because together, you know, we can make this happen. So thank you for being here.
Thank you. You can learn more at www.blueoaknx.com.